So welcome back to part 2 of the blood gas analysis tutorial. I hope you enjoyed the first video and I hope you enjoyed doing the quiz and that you got the answers you expected to get. If you didn't, I hope you went back to the grid, re-put them in again and found the right answer and the correct diagnosis. Now, I would remind you that I haven't gone into any detail about the blood gases in great depth. I'm not looking at an ICU level analysis of this. Equally, I'm not looking at the scenarios or the patient illnesses they've come in with. I'd expect you to go away and have a look at those and find out what sort of symptoms patients would have if they had certain illnesses, and then balance these two up. Equally, I haven't given you any examples here of how you manage to treat these patients. Remember, this is cognition and interpretation. It's about how you interpret the information you're given, and you will get to year 3 where you'll start to explore in a little bit more detail about some of the management of the patient with these complex details. So I hope that gives you a bit of perspective. Now, this next one is, I want to say, slightly more complex, but it's not really, but it's starting to look at some of those other ones and just input them into our grid to show you how simple they really are. So we're going to follow exactly the same process. We're going to put our details in with our patient as we did before. We're going to compare it with what we know is normal, and whether if it's abnormal, whether it's acidotic or alkalotic. And then we're going to input this into our noughts and crosses grid as we did before. So we'll crack on then. So our first patient comes in with a pH of 7.3. They've got a PCO2 of 6.2 and they've got a bicarbonate of 30. Again, exactly the same process. We're going to take 7.3 and look at our pH normal and work out that it is below what is normally expected. And that makes it an acid, an acidosis. So we put pH in the acidosis column. Remember, we're trying to get a line to win at noughts and crosses. The PCO2 is 6.2, and we come across to what is normal and find that it is outside of the parameter, which makes it an acid. So what we know is from what we did earlier on that this is a respiratory acidosis. But we've still got to look and see what the bicarbonate is doing. And the bicarbonate is 30. So if we jump across to the normal, we see that 30 is above 28, which makes it an alkalotic. So we actually put HCO3 in the alkalosis column. Now, what's going on here is we have no readings which are normal, but we do have our line here. So we have a respiratory acidosis, because we can see that, but we also have an abnormality with our bicarbonate. Now, what's going on here is the bicarbonate, or the body's response, is trying to respond to that. So that's why these are abnormal. It's trying to respond to rectify this situation. So because it's doing that, and because these are abnormal, and it's trying to fix that problem, this becomes compensated. And again, I'm not going into detail about whether it's partially, fully, or whatever else. It's just there's a compensatory mechanism going on with the body to fix the acidosis. So in this instance, it's a respiratory acidosis compensated. Great, so we'll do another one. I hope you are getting the hang of this, and you can see that it is at the moment as simple as putting numbers into a grid. So our next patient comes in with a pH of 7.5. He's got a PCO2 of 4.0, and he's got a bicarbonate of 21. Exactly the same thing. 7.5 is above 7.45, makes it an alkalosis. So we put pH in the alkalosis column. Remember, PCO2 is 4.0, PCO2 is 4.6, is lower than that, so it makes it alkalotic. So PCO2 goes into there. So now we know this patient has a respiratory, because this is the respiratory element, alkalosis. But we've still got to look at the bicarb again. Bicarb is 21. If we come across here, we see it's lower than the 22. So the bicarb will have to go into the acidosis column. It's lower than 22, acidotic, into there. Like the last one, we have a win. We have a line. I suppose it's not really a win for the patient, but we have a win. And this is a respiratory alkalosis. But we now also know that the patient has got the body trying to respond to that with the bicarb by trying to fix this. And because it's trying to fix this, this is what we call that compensating again. It's trying to compensate here for this. So it's compensated. Okay? Let's do another one. So this patient comes in with a pH of 7.3, a PCO2 of 4.0, and a bicarbonate of 21. Exactly the same process again. 7.30 is lower than 7.35, makes it an acidosis. So there's pH in there. 4.0 is lower than the 4.6, which makes the PCO2 alkalotic. So we put that under the alkalosis column. Now in those situations where you're playing noughts and crosses and we don't actually know who's going to win this one, but we come across the bicarb, which is 21. 21 is lower than the 22, which makes it an acid. Now we've got the win on that line. So this is the metabolic element, we said that there. And so it's a metabolic acidosis because we've won in that line. Metabolic acidosis. And again, we have nothing in the normal columns. None of the parameters are normal. But the PCO2 is in the alkalosis column, the opposite to the acidosis column. So the PCO2 is trying to fix this, or trying to rectify it, trying to compensate. So it is a metabolic acidosis compensated. I hope now that you're starting to get the hang of this and see that on a simplistic level, it's relatively easy to understand. So I've got a few more. So this patient comes in with a pH of 7.5. He's got a PCO2 of 6.5, and he's got a bicarbonate of 30. So again, exactly the same process. Patient compared to normal into our grid. 7.5 is above the 7.45, which makes this an alkalosis. So we put a pH, forgive me, put a pH in the alkalosis column. Sorry about that. 7.5 above 7.55, alkalosis into the alkalosis column. PCO2, 6.5, compare that, is above the 6.0, which makes it an acid. So we put the PCO2 in the acidosis column. That one is correct. But we've got to look at the bicarbonate again. And in this case, it's 30. We compare it to this, and we see it's above the 28 for the bicarb, which makes it an alkaline. So we put the bicarbonate in there. Now we know this is a metabolic, because we've said that with the bicarbonate, it's metabolic. Metabolic alkalosis. Alkalosis. And because we see that the PCO2 is trying to fix that, and it's not normal, none of them are normal, this is abnormal and is trying to compensate, it becomes a compensated metabolic alkalosis. So, the final two that I'm going to do for you. If you see these, you've probably got quite an unwell patient. To be fair, a lot of these patients would potentially be quite unwell. This patient comes in with a pH of 7.2. He's got a PCO2 of 6.5, and he's got a bicarbonate of 21. Exactly the same process. 7.2 with a pH makes it an acidosis. 6.5, we compare that with our PCO2 and find that is abnormal. It's above 6.0, which makes that an acidosis. Still, we've got to look at the bicarbonate. 21. Compare that to what we've got here. It is lower than the 22. We actually don't have enough columns. So actually we've got three elements there. We've got the respiratory acidosis, and we've also got a metabolic acidosis. So this is a combined respiratory and metabolic acidosis. This patient is probably quite unwell, given that those two parameters are abnormal. And of course it wasn't compensated in that example because they were all acidotic. Now the final one, I'm sure you know where this is going, but these are the parameters. So finally, 7.6 for his pH. We compare that to the pH over here and find it's higher than 7.45 and therefore it's alkalotic. We come down to our grid for pH in the alkalosis column. We then look at the PCO2, which is 4.0. Compare that to what we know as normal and see that it's lower than 4.6. Therefore, it is an alkalotic. I think no prizes for guessing where the next one's going to go. 30 for the bicarb. Look at the normals. It's actually above 28. So if it's above 28, it makes it alkalotic. And like before, we don't actually have enough spaces, but we do have a line. So in this instance, we've got nothing in the acidosis, nothing in the normal, but actually we've got an alkalosis. And because we've got both the respiratory element and the metabolic element, this makes this a respiratory and metabolic alkalosis. And again, like the previous one, this patient is probably quite unwell. So I hope you enjoyed this video. I know there are other elements of blood gas analysis that I haven't covered, but for the purposes of this year and this module, I hope this has given you some information that you can go out and confidently look at blood gases and actually start to work out what's going on with them. And as a final note, I remember the first time I ever came across somebody with diabetic ketoacidosis. It was going through a process like this that helped me really understand what was going on with his blood gases, but actually equally observing the patient, seeing how they were presenting themselves, and then following that up with, okay, what's the treatment that we actually need to provide? So once again, thank you for watching this video, and I hope it's been helpful.